I am Dr. Ezra Reber. I am the owner and medical director of Palmetto Pain Management. After finishing medical school, I was very interested in becoming an anesthesiologist. Anesthesiology by itself is a fascinating field, but there's very little patient contact. The attractiveness of becoming a pain specialist was that it afforded me the opportunity to be a physician that sits down and interacts with patients more.
My name is Jennifer Diane Stanislaus. I am an interventional anesthesiologist, so I have a medical degree. I went to Duke University in Wake Forest for training. I was born with something called congenital hip dysplasia, and it's just where your hips are not completely aligned, and I was in a cast and had surgery throughout my whole first year. My mother always tells me that the pediatrician pretty much got her through it, and I always admired doctors for it, and so I figured I was going to be a doctor. When I went to anesthesiology, I was very impressed and loved the fast pace and the minute-to-minute changes in the operating room and in the intensive care unit. What I didn't like was that I never had my own patients, right? These patients, I would have them for a period of time and then they would go back to their primary care service. So chronic pain was a unique aspect for me because you had your anesthesia part, but you also had your own patients. And after going through the field and realizing really the struggle that a lot of chronic pain patients go through, I've just had a special interest, and that brought me to become a chronic pain physician.
We are all very interested in people here. From myself to the other physicians practicing here, we genuinely care about people. It filters down to the staff, and so we impress upon potential patients and the referring doctors that we have a very warm environment because our patients are in pain, they're uncomfortable, their days are bad, their nights are often bad, and we want people to know that when they come here, we're going to listen to them, we care about their pain issues, and we consider it a challenge that we want to meet to find out what's causing their pain and what we can do about it.
I think the biggest thing for me is that I'm giving them some type of life, some quality of life. Truly to see a patient come in and say, look, my life has been altered and I can no longer do the basic activities. I can no longer be with my family and my friends. To have them come back months later and say, look, I took my grandchild to the zoo today. That to me is success. You know, I don't need a big award or anything, just to have a patient come back and tell me that they were able to get their life back or resume some of their life. That's kind of the best thing about what I do.
I can't describe for you how wonderful it is to have a patient that first comes here that has had failure after failure, and many times they're hopeless. They don't feel that there's anything that can help them. And the feeling that I have and the other physicians here, and really everybody that's here, when people feel better, we all share that enjoyment, and we're also proud of what we do. I can only say that I have an insatiable desire to try to get somebody better. If there's any way we can do it, and if any way we can do it safely, we're going to do anything and everything we can.
The biggest driving force, again, is to know that I am giving patients quality care. It's a very big disappointment when I meet a patient for the first time and they say, you know, you're the first person that's listened to me for a very long time. Or I've been completely disappointed in the healthcare system and you've given me some hope. Those are things that it really, you would think, oh, that makes you feel better because they're telling you you're this great doctor, when in reality, I really feel like I'm just being a doctor, what a doctor should do. I think I strive to show patients that there still is doctors who care, who truly genuinely want to help. It's not about the money, it's not about the numbers. We really do care about our patients and seeing a good outcome with them.
Things that many of us take for granted, just day-to-day things like sleep, driving a car, doing some shopping. People that we see have so much trouble getting their basic activities done, or if it comes to playing a sport or playing golf or going fishing. We have so many people that can't do what they want to do. Our mission is to get patients back not only to a less painful lifestyle, but a healthy lifestyle. We are very interested in wellness, and we want you not only to feel better, but to have a healthier lifestyle.
The typical chronic pain patient is very frustrated by the time they get to my office or to see Dr. Reber and myself. And that's because they've seen multiple doctors who have all kind of passed them off like a hot potato. Point of caring and making sure that they were given their chance and given a proper workup just wasn't done. So when they come here, I hope they're reassured that we are going to take that time. We're going to allow you to talk. We're going to listen. And we're going to try to come up with a plan tailored for them as a patient and do our very best. And I always tell patients, I don't have a magic wand, right? I don't have fairy dust. I don't try to sell a dream. What I do tell them is that I care greatly about them, and I want the best for them.
I can only imagine that most of the patients that come to see us for the first time are thinking, oh gosh, this is just going to be one more visit. I've had so many failures, so many disappointments. But I want those patients to know that I really feel in my heart and in my brain that this visit is going to be different. We're going to demonstrate to you that we have the expertise along with the caring about your pain. We're going to do everything we can to figure it out. One of the things I hear in my first visit with patients oftentimes is, Doctor, thank you so much. You've given me some hope. And when someone tells me that, that spurs me even further to say, I'm going to try to come through for this patient who I've given hope to.